So thank you for joining us today for this Health and Safety Town Hall as we look ahead to the start of school on Monday. It's been so great welcoming our faculty and staff back to campus last week. And then this week, of course, it's been super fun to have students on campus. It just isn't the same without our faculty, staff, and students. And it's been so invigorating to have everyone back on campus this week. And we really do look forward to next Monday. As we look ahead to next Monday, and before I turn this over to Christy Holman and Emily Adams from the Health and Safety Task Force, I have a couple of important things that I want to share. First, I want to express my gratitude to Christy and Emily on behalf of the entire Wolverine Nation, really, for their hard work in leading our Health and Safety Task Force. They have a great team on that task force, including Dana Ferguson, our school nurse, board chair Glenn Shaw, Lee Block and Selena Diop from athletic department, facilities director Jackie Porbianski, director of communications and marketing Karen Park, safety and security director Jose Bermudez, and director of human resources Derek Williams. Michael Arjona and I are also on there as time allows, and I'm just so proud of the countless hours this team has spent putting together our health and safety plans, enlisting the help of medical experts right here in our Walker community, and like you, I'm so proud of their efforts to keep our campus safe and to prepare us for having school on campus again. Just want to say thank you to each of them from all of us, because so many of you have expressed to me your gratitude for all of their hard work, and I know that goes for our teaching and learning team as well. And on a serious note, and I think it is important to remember that from a health and safety standpoint, what I'm getting ready to share is serious. We've put this phrase together: Wolverines must protect Wolverines. And this is really important as we look ahead to school starting next week. This morning I was reading in the newspaper from Dr. Robert Redfield, who's the director of the Centers for Disease Control and Prevention right here in the metro Atlanta area. And he shared these words, quote, "For our country right now and for the war that we're in against COVID-19, I'm asking everyone to do 4 simple things: wear a mask, social distance, wash your hands, and be smart about crowds." I'm not asking some of America to do it. We all have to do it. And those words from Dr. Redfield really struck home to me, and he's echoing a chord that we've been saying all along here from the Health and Safety Task Force at Walker. It's really important that we adhere to and hold each other accountable on campus and off campus with consistency and with grace and gentleness as we carry out the 3 W's: washing our hands frequently, wearing a cloth face covering, and watching our physical distance. Dr. Redfield added a 4th about being smart about gatherings and crowds. But those 3 W's are really, really vitally important as we lean into the start of school next week. And I just don't think we're going to be able to emphasize those priorities enough. And the more we can do that at home and at school, the sooner we'll get to the place where it's just second nature. I was actually sitting at my desk today writing some letters and noticed that I had my mask on and I didn't even realize it was there. I'm hoping that comes for all of our students pretty quickly, because it was actually kind of fun to realize that I didn't even notice that my mask was there. But obviously that takes a little time. And then finally, I want to say again, reiterate again, we are all in this together. And if we all work together and follow these guidelines and requirements on campus and off campus, we will minimize our risk and be better able to protect ourselves and each other. And I know that's what we all want to do. So thank you for being with us today. I can't wait for Monday. I'm really looking forward to having our students on campus. And I want to turn it over to Christy and Emily. Emily, over to you. You're muted, Emily. Just a little grace there.
Thank you. I appreciate the grace. Hello, everyone. It's so good to know that you're here in this virtual space with me. As a fellow Walker parent, it's been so gratifying to see students on campus and virtually this week. So we wanted to walk through some of the questions that have been sent in so far and walk you through what our mitigation strategies are and our rationale behind them. So our first question is, what phases are we in? And I apologize, there we go. We are currently in orange, and if you want to know what phase Walker is in at any point, you can go to our website and look at the coronavirus page, and there's a banner at the top that lets you know what phase that we're in. So you can see that in the orange phase, primary and lower school are on campus every day in small groups, and middle and upper school are in a hybrid model where students come to school 2 days and then they work through Walker Connect 2 days, and then the other group of students switch. We are open with significant mitigation strategies in place. And from a community perspective, we're in orange when there are many cases with community spread. And I think a great question that has been sent in is, well, what determines when we go from orange to red? How do we decide that? We use a lot of different metrics for that. We don't use just one number. Every day we're looking at the Georgia Department of Public Health data. We're looking at Cobb-Douglas public health data. We're looking at the Harvard Global Institute data, Children's Hospital of Philadelphia Policy Lab, the Path to Zero, a wide variety of sources, in addition to being in very regular communication with the Cobb-Douglas Public Health Department. We also have several task force members that attend the special meetings that Cobb-Douglas Public Health has for school leaders in Cobb and Douglas County every 2 weeks. So I think one thing that's particularly helpful, if you look at the Georgia Department of Public Health website, if you're looking at the graph, you want to be sure that when you look at Cobb County, and that's the community that we're paying the most attention to since that's where Walker is located, you want to be sure that on the graph that says COVID-19 over time, that you actually click date of onset. So date of onset symptoms rather than the date of the test. If you look at date of onset, which gives us a better picture of what's going on, you can see that the number of cases per day in Cobb County are actually going down and stabilizing from a post-July 4th peak. Dr. Memark, the Cobb-Douglas Public Health Director, has also sent out several statements saying, you know, we're heading in the right direction as a community. Those 3 W's that we're supposed to be doing, more and more people are doing, and it's making a difference. So we meet as a health and safety committee twice a week, if not more, and we've always got kind of our hands on that pulse point of what does the community look like in Cobb right now. So why do we have to do all these things that are new and different and can be hard, as Jack was getting at with the few times you wear a mask? It can be really difficult, and then you habituate to it and you get used to it, and it's not as big of a deal. Well, we know that mitigation strategies are essential and effective in reducing or preventing the spread of COVID-19 in a community. And we see that when those systems are not in place. So these are a couple of recent headlines. And the reason that I'm bringing these up to you is that these 2 outbreaks occurred because the mitigation strategies were not followed. So for example, in the Israel incidents in this particular school, they had lots and lots of kids in the classrooms, not physically distanced, which is something that we can and are doing at Walker. And also when the air conditioning broke down, they just stopped wearing masks. So we had very little physical distancing and very, very low mask use. So we know that those are the situations that can happen when we don't take those mitigation strategies seriously. And as a community, we are committed to do that to keep our community members safe. So just a quick refresher about how COVID-19 spreads. The predominant way that it spreads is through droplet transmission, which is when respiratory droplets that come from talking or coughing or sneezing or singing or yelling leave your mouth, and because the droplets are larger than aerosol particles, they tend to fall with the help of gravity within about 6 feet. That's one of the reasons that you're hearing that social distancing of 6 feet. It's possible that surfaces and some limited aerosol transmission could be modes of transmission, but the vast majority of cases that we see, the evidence shows that they're droplet transmission. So when we think about what puts someone at high or low risk for contracting COVID-19, we want to think about situations where I might put myself closer than 6 feet to someone for an extended period of time. That's a more risky situation. So if I'm in my classroom and I'm having a conversation with students, I'm going to reduce my risk and the risk for my students by stepping back so that I'm more than 6 feet away. So in every situation, our health and safety committee and our faculty and staff are thinking through, when we are interacting with each other, what are ways that we can drive that risk down? I want to quickly go through the symptoms of COVID-19. Typically, these appear within 2 to 14 days after the exposure to someone who's infected. Not everyone is going to have all of these. And if you look at this list, it's a wide variety of symptoms because this virus infects and affects so many different parts of our bodies. A couple of things that I think are particularly important to note. Let's say, for example, I have allergies. I do. I have summer allergies. And one of the symptoms of COVID-19 on this list is congestion or runny nose. Well, a little bit of a runny nose is my normal right now. So really what I want to be thinking of is what's outside my normal. So for example, if someone has migraines, headache is one of the symptoms of COVID-19. That person knows what their migraine feels like. So a headache that is different than their normal is something that we really want to be on the lookout for. One of the most important things that you can do is when your child has any of these symptoms, please keep them at home. They can engage readily in Walker Connect, and they have that time to heal and recover and not potentially spread infectious disease to members of our community. And we're going to talk more in a minute about what does return to school look like after you've experienced those symptoms. So what are some additional things that we know from a science perspective about COVID? As I mentioned, different people have different constellations of symptoms. So not everybody's going to have everything on the list, and there's not a single symptom that's like, aha, that's COVID. Which is one of the things that makes it challenging and makes using our 3W strategy so important. We know that children are more likely than adults to experience either mild or no symptoms than adults. However, they can still transmit the disease. Whether they're just as effective as adults at that, the data is still coming in as we go through this experience. It does appear that children might be more likely to experience the GI issues, the diarrhea especially, or the nausea and vomiting more than adults. So that's just a little something to keep in mind. What are the symptoms of COVID that we really worry about though? There's 5. If you or your child or someone that you are around is experiencing trouble breathing, persistent pain in the chest or pressure, new confusion, the inability to stay awake or to wake up, or if they have bluish lips or faces, we need to call 911 immediately and get them emergency medical care. And we know on campus to be on the lookout for those symptoms as well. So let's talk about those 3 W's again. You're going to hear them a lot. Your kids are going to hear them a lot. They're going to become pros at them. It's really vital that we follow these strategies because the data shows that these strategies are incredibly effective at preventing the spread of disease. We know that we can't control what happens off campus. So is it possible that someone is going to come to campus carrying COVID? It's very possible. However, if we use those 3 W's, the likelihood of transmission that happens on campus is going to be very, very small. So let's go through the 3 W's. The first is wash your hands. We know, we've heard this. It's a great strategy. It doesn't just work for COVID, it works for flu and all the other germs that are around. So we want to wash our hands with soap and water for at least 20 seconds. And if we are using hand sanitizer, we want to make sure that we're rubbing our hands until they're completely dry. That really ensures that that hand sanitizer is doing its job. So what are we doing at Walker about washing our hands? Well, we have developmentally appropriate materials for each division to help train the kids on how to do it the best way possible. And we have set up in our day for kids to wash their hands when they arrive at school, before and after recess, before and after snack or lunch, or using shared equipment, and after using the restroom. I think it's also a great idea, and I'm training my boys, as soon as they get home, they take their face cover off and they immediately go to a sink and wash their hands with soap and water. Hand sanitizer, we don't want the primary or lower school kids to bring their own hand sanitizer. We have that there for them, and that way the teacher can safely monitor its use. The next W is wear a face cover. So I wanted to take a minute and let you know what kind of evidence or data are we using to make these recommendations. Members of the Health and Safety Task Force are regularly reading and analyzing primary scientific research articles that are peer reviewed. So that's what we're using to make our decisions. And as you know, studies are coming out all the time. So we continue to evaluate any changes in our knowledge to COVID-19. And because we're agile, we can make changes as we need to. We're also using CDC's GRADE criteria, which is a pretty stringent grading analysis tool to evaluate the quality of a study. And so we're really looking deeply for valid science to make our decisions with. And the research that's out there and the recommendations from public health professionals show that cloth face covers, and I'm abbreviating, so CFCs, can reduce droplet transmission by 50 to 80% or more, depending on the fabric and the fit. And we'll talk more about those in just a second. Cloth face covers do not cause hypoxia or low oxygen levels or excess CO2 retention. It just doesn't hold up. CFC use, when combined with high compliance, so lots of our population are wearing those cloth face covers, and physical distancing, have the amazing potential to just stop transmission in its tracks. And so that's why we're really emphasizing this combination. So what should face covers look like? Well, we want to make sure that kids have a second face cover at school with their name on it. They can keep it in their backpack, or if your teacher has particular guidelines for that, you can follow those. If it gets wet or dirty, or they sneeze into the mask. I did have a conversation with one of my own kiddos that if you have to sneeze, sneeze in the mask. Don't take the mask off and then sneeze. I didn't think I was going to have to say that to my 8-year-old, but I did. And so now I know that's a helpful thing to communicate to your kids, because they just won't have thought about it. They don't want to get their mask dirty. But if they sneeze into their mask and they have to change it, they've got that spare. So our guidelines for acceptable face covers include the following. Fit matters. We know that a mask that has large gaps reduces its effectiveness at preventing others. So it should fit snugly, but it should be comfortable. I think in particular, to help with the fit, having one that has the nose bridge so that you can form fit it to your face really helps. And if you wear glasses, I know that helps reduce the fogging as well. Face covers should not require constant adjustment or droop off the nose, because we know in order to be effective, we need to cover both of those respiratory entrances, our nose and our mouth. And it's a surface where droplets could land. So if it doesn't fit well, I'm going to constantly be touching it, which could increase the possibility of transmission. It should be secured with ties that go all the way around the back of the head or ear loops. It should include at least 2 layers of tightly woven fabric. So high thread count is better. Cotton is a great choice. Cotton and polyester or spandex blends use different mechanisms to block the disease, and that's particularly helpful. It should still, though, allow for breathing without restriction. So you should feel like you can breathe normally. Effective masks or masks that are acceptable on campus do not have that little exhaust valve on the side, because those don't protect the people around the person who's wearing the mask. I think we also had a question about the scarf style. We really want it to fit on the face. They need to be able to be washed daily. I bought my kids a week's worth of masks, and so we just are gonna wash them at the end of every week. And so we wanna make sure that those masks, if they're reusable, that you can wash them. Masks that are not acceptable: face shields, just the plastic face shields, except for specific circumstances, which I'll get to in just a moment. Bandanas, because the thread count of that cotton is not high enough, and also the fit is very poor. Or neck gaiters without multiple layers of tightly woven fabric and ear loops, so that they don't fall down and have to be constantly adjusted. So when and where are we going to require our community members to wear cloth face covers on campus? This document was adapted from the organization Resolve to Save Lives, which is an international public health organization led by Dr. Tom Frieden, who's the former director of CDC. So all of these say that, do I need to wear a face cover? Well, if consistent and predictable physical distancing is possible, that's what we're looking at in this second column. So that physical distancing has to be both consistent and predictable, because if kids or adults are going to be coming close to each other, we need them to have their cloth face covers on to protect each other. So in orange, if we are on campus and outside and predictable, consistent physical distancing is possible, cloth face coverings are not mandatory. If we are outdoors and we cannot predictably socially distance, face covers are mandatory. And indoors, regardless of whether or not we can physically distance, we need to wear our face covers. So let's just talk a little bit more about those expectations for the cloth face covers. So what are the exceptions besides the indoors versus outdoors? Students in the primary school taking a nap will not be wearing cloth face covers. When eating or drinking, if you've seen those masks that have a hole for the straw, those are clearly not effective. When alone in a confined room, like an office or a classroom, but not a common space. So a hallway is considered a common space, so we need to have our cloth face covers on at all times. If someone is having trouble breathing or is unconscious or is incapacitated and can't remove that on their own, then that is an exception. Cloth face covers will always be worn when riding on the bus, and if we are traveling together in other vehicles. So for example, if I am riding with a neighbor's family, if we're in that car, we're inside and we really need to protect each other by wearing that cloth face cover. So anyone who's not in your kind of nuclear family unit, if you're in a vehicle with them, you really want to wear that face mask to protect yourself and them. Also, students and teachers who are in a class where they are engaged in particular learning activities where being able to see the mouth or the tongue are important to instruction are encouraged or allowed to wear those face shields during that specific instructional time. And then as soon as it's done, they'll put their cloth face cover back on. If you are new to wearing cloth face covers, it can take a few days to get used to. So we are making sure that we're building face cover breaks into the day for our students. And depending on the phase we're in, it will determine like when and how those happen. But we've built in several times a day where kids are going to get a break in a safe, physically distanced way. If your kids haven't started wearing a cloth face cover yet, I would encourage you to do that, today or tomorrow. Just start with little chunks of time so that they can get used to it and comfortable with it. And they can see that they can do this, it's just fine. They can still talk with their friends. You can still see the crinkles in someone's eyes when they're smiling. I think that's a very important thing to do. So our last W is watch your distance. Because the transmission of this disease is predominantly through respiratory droplets, we need to be at least 6 feet away from each other. This one is super key, and it's one that people really have a hard time with. With my new 9th grade advisory today, I showed them a piece of string that was 6 feet long, and they couldn't really believe how long that was. So I might even just help at home if you've got a measuring tape to pull it out and show your kiddos what 6 feet look like, so they can really kind of get that mental picture. We've got great stickers on the floor on campus so they can visualize that as well, and teachers are going to be helping them kind of recognize that safe distance. The impact of physical distancing on this disease is huge, and Christy will talk about it more in a minute when she talks about a close contact versus a non-close contact. So I think that this particular graphic is very helpful to show how the transmission of COVID-19 is reduced when we combine wearing face covers with that physical distancing. So what are the group size limits? Well, in orange, if we need to do large gatherings, they're going to be held remotely. We are having in-person groups be groups of 10 or less, and that includes the teacher present. Some primary and lower school classes have 10 to 11 students because we can safely socially distance based on the room size and occupancy in those groups and the reduced transmission rates that we see in children of that age. So that's a little bit of a data and science background. And now Christy is going to talk about what it's going to look like when kids come to school.
Thank you, Emily. We are excited about having kids on campus, as Emily mentioned and Jack mentioned earlier. And I can tell you, I've personally had 2 kids on campus for summer camp starting in July. They were here for almost every single day. And I got to witness so many summer camp students here enjoying themselves thoroughly while they were on campus. And my 2 children who were in the primary school, in the 3-year-old program and in the kindergarten program, they were completely unfazed by the mask. I will tell you, I struggled to imagine how my 3-year-old was going to handle a cloth face covering all day long. And by the 3rd day, I asked my 5-year-old, does he put it on and off, take it on and off himself? And he's like, yeah, he's a pro. He does it all himself. So I do think the more acclimated our children can become to it before they are here on campus, we are all going to be shocked at how easily they adapt to using those cloth face coverings here on campus. So let's talk about the start of the day. And I want to first of all mention, we are working on a software product called School Pass. We mentioned it in the health update we sent out earlier this week, and we're hoping to implement it over the course of the next 2 weeks. The company is still working on a couple of additions to it, and they're working on getting their newest app approved in the Apple Store. So we'll be able to get that information out to you very soon. But what that's going to allow us to do is, A, run carpool a little more smoothly and keep students in their classrooms during carpool, which was one of the questions we had in the Q&A that we accumulated prior to this. And then also it's going to help the screenings, particularly the symptom screenings, in the morning run a little more quickly, because you'll be able to answer questions for your students, or if you're a middle school or upper school student, you may be able to answer those questions yourself, those symptoms questions, prior to your arrival on school ground. And they'll also give you a very clear indicator about whether or not you should have your child on campus. As Emily said, one of the best ways we can keep our families and our students and our faculty members safe is to make sure we don't come on campus if we are exhibiting the signs and symptoms of COVID. So those screens will be mandatory in orange and yellow. And what we're looking for, this is an example of what you'll expect to see next week. If you're in the primary school and lower school, and what your students will be asked if they are middle school and upper school students. Have you experienced any of the following symptoms within the last 24 hours? And the list of those same symptoms we reviewed earlier. Have you been in contact with anyone experiencing those symptoms? And do you have any reason to believe that you've been exposed to or that you have COVID-19? And you should really be able to answer no to all those questions, or you should stay home. If you need to stay home, then you can contact the school. We have a dedicated email address, schoolnurse@thewalkerschool.org, where you can contact one of our 2 nurses on campus, and they'll be able to guide you through the process to re-enter campus. Another interesting thing about some changes we made here physically on campus is we are going to have 3 thermal cameras on campus. One will be in Gaddy Hall for lower school students. One will be in the mezzanine for 9th, 10th, and 11th graders. And then we have a 3rd one here that's going to be in the Bowden Library for seniors and for middle school students. We're changing the drop-off slightly for the middle school students so that they can easily enter that backdoor Bowden hallway. And we will be able to quickly do temperature screenings for all of those students. So it will greatly reduce the amount of time that we would have to if we didn't have these thermal scanners. If a student can answer the questions properly or answer them with no's, I guess. And then if they, as long as they have a temperature of 99.9 or less, then they'll get a wristband. Today's green. We have our green wristbands. We're walking around campus and you can have a visual that everyone has been screened, has had their temperature taken, and they're ready to be on campus. So as Emily said earlier, one of the things that we really emphasize with our faculty and staff, and we'll be doing the same thing with our students when they're on campus next week during their training, is don't be a close contact. What we want to be able to do through these mitigation strategies is keep as many students, as many faculty members on campus every single day as possible. And a key to that is maintaining physical distance. Close contact, the definition is a CDC definition. And it's if you've been within 6 feet of someone for 15 minutes or more, within 48 hours of their developing symptoms, or during the time that they are symptomatic. So anyone who meets that criteria would be considered a close contact. There are a few other criteria as well. If you provided care to someone at home who is sick with COVID-19, if you've had direct physical contact with a person, touching, hugging, kissing, shaking hands, any of those would be considered direct physical contact. If you've shared eating, drinking utensils, lip balm is another very good example that the Cobb Douglas DPH likes to use as it relates to students. Or if you have respiratory droplets that have landed on you, so if you've been sneezed on, coughed on, or in some other manner gotten respiratory droplets on you, any of those would be considered a close contact. So what does it mean if you are a close contact? It means that you will need to be at home quarantining for 14 days, monitoring your symptoms to make sure that you don't develop the signs and symptoms of COVID. And what we will do internally is we'll make sure that you if it happens here on campus, we'll make sure that you receive a letter and we have a conversation with you in a follow-up between you and one of the COVID support team. And then what would happen if you were a close contact outside of campus is we would expect you to make sure you let us know, because you would be excluded from campus. And so that gets us to our very next slide, what it means to be excluded from campus. First of all, to mention the 3rd time, if you're sick, stay home. That really is key. But any students or employees who have met the criteria, the following criteria should stay home. If they've tested positive for COVID-19. This is not listed here, but if they've taken a COVID test and are awaiting the results, they should also stay home. If they're exhibiting the signs of symptoms of COVID, if they have a temperature of 100.0 or higher, or if they've had close contact with someone who has been diagnosed with COVID. Close contact would mean close direct contact. So for instance, if my husband, who works in the upper school, he is a drummer, some of you know this, if he gigged on the weekend and he was exposed to someone who tested positive for COVID, he would need to stay home. I do not have to stay home. I can continue to come to work. My children could come to school every day. unless Rob started to develop the signs and symptoms of COVID, in which case we would also need to make sure that we were staying home as well. So what does it look like if you have symptoms of COVID? First of all, if you don't have any symptoms, you're welcome to proceed to campus. We have the option for Walker Connect. Any family can choose to participate in that at any of the phases that we have outlined. But if you have no symptoms, you're welcome to come to campus. If you have one symptom, then you would need to stay home. You could proceed to Walker Connect. You can have access to all of your learning from home, and you would need to stay home until your symptoms have resolved and you've been fever-free for 72 hours without the use of medication. Or alternatively, you could go to your doctor and you could get a physician's note stating that you did not have COVID, in which case you would need to coordinate with one of our nurses, either Dana Ferguson, Tony Morris, and you could do that through nurse at the walkerschool.org, and you're welcome to come back to campus. But what we really want to do this year, more so than any time in the past, is make sure we have really thorough dialogue between the school and between families about students who are sick.
Christy, is it school nurse at the walkerschool.org or Walker nurse?
I think it's school nurse at the walkerschool.org. I can confirm.
That's what I typed in. Okay.
We can confirm by the end. And one thing I want to mention as we're talking about this is we really are not in a position as a school to diagnose. And that's why we have to rely on these guidelines, and that's why we have to rely on medical professionals such as your own personal doctors to make sure that we have an environment where we're keeping the students on our campus safe and where we're trying to keep anyone who's exhibiting any of the signs and symptoms of COVID at home. So if you have a diagnosis of COVID-19, but you don't have symptoms, so if you're asymptomatic, you would need to isolate, and you would be isolating for 10 days after you had your positive COVID test. And if you happen to have been on campus during that time, we would consider anyone a close contact who met that close contact criteria that we mentioned earlier, as long as they had been in contact with you within 48 hours of when you had your positive test result. If you have a diagnosis of COVID-19 with symptoms, you would also, you could feel free to proceed to Walker Connect, engage in as much learning as you feel comfortable doing, and then you would be able to return to campus after 10 days, so long as you have been fever-free for 24 hours and as long as your symptoms have improved. One thing to note is in all these cases, not just the one with the one symptom, we'll be engaging in constant dialogue just to make sure we understand how you're feeling and to make sure that we have really good information about when you should be able to return to campus. Exposure or suspected or confirmed COVID, exposure to suspected or confirmed COVID-19. We talked about that earlier. If you are a close contact, if you have been exposed, then you can return to school after 14 days. If you start to develop symptoms, then you might move into one of these other categories. So maybe your quarantine or isolation might extend longer. Then we'd look back at either of the categories that you fall into. What we are recommending, based on our conversations with Cobb Douglas DPH, is if you have been exposed to COVID-19 and you would like to have a COVID-19 test, we would ask that you not have that until day 10, because that gives the virus plenty of time to build up in your system, and then you would continue to quarantine for those remaining 4 days, because that is the guidelines from the CDC. But if you wanted to have testing, day 10 is really the ideal date to engage in that testing. So what's the difference between quarantine and isolation? And I'll tell you, we have been engaging in bi-weekly conversations with Cobb Douglas DPH at the school level. There's several of us who have been doing webinars for all the schools in the Cobb Douglas area with DPH. They've been fantastic, extremely helpful. And they mentioned in our last meeting that this is one of the things that's been most confusing for schools and for the general public as we navigate this COVID environment. Quarantining means that you don't have symptoms, but you have had close contact with someone who is COVID positive. And if you need to quarantine, then you would quarantine for 14 days. Isolation means that you would be for if you're sick, you'd be separated from others because you've been sick. And in this case, it would be sick and diagnosed with COVID-19. And those guidelines are different. That's what we just discussed on the previous page. And it would be based on the 10 days and then the resolution of the symptoms, fever-free for 24 hours. So suspected case on campus, what will happen? And I feel like I should mention, we feel very confident that we're going to have, in fact, we've already had 2 cases on campus over the course of the summer. We are ecstatic because the mitigation strategies we had in place worked. There was no community spread from those 2 cases on campus. They happened to have not been symptomatic while they were on campus, which is what we hope will continue. But given the level of community spread in Cobb, Douglas, Cherokee counties, we do we feel strongly that we need to be prepared to have a good protocol for a suspected case on campus because we are fully anticipating having cases on campus. So we have drafted some isolation policies. The first thing is we finished a training with our faculty and staff last week. We want everyone on campus to fully understand what those signs and symptoms of COVID are. So we want our faculty members, when they're doing their temp screenings, they should be looking physically at the students. And I should have mentioned in the temp screening, not only will students be temp screened, but also faculty will be temp screened, and any people on campus, visitors to campus, vendors on campus, they will also be temp and symptom screened. So everyone who enters these campus doors will undergo that same screening. But we want everyone to be well versed in those signs and symptoms of COVID so that we can move children from classrooms, move teachers from classrooms, move employees from their offices into those isolation spaces as quickly as possible. We have 4 isolation spaces on campus. We've even put a new door, and I've mentioned this at a previous webinar, but we're really happy that we've added a new glass door to the sick room across from Nurse Dana Ferguson's office so that students or employees of school can go to that isolation space. We can keep the door closed and we'll be able to monitor through the door anyone who's in that space to make sure they're safe, but we'll be able to keep them fully isolated. What we've also done to those isolation rooms is we've added needlepoint bipolar ionizers to the HVAC system in those areas because we do expect additional respiratory droplets and aerosolization in those spaces. So we want to make sure we have something cleansing the air in those isolation spaces. Part of what we've done for our faculty and staff, and we've shared it already with bus drivers, with substitutes, with all of our faculty and staff, we have a recording of it that we are sharing even on a shared drive as we add additional staff through the school year, is to make sure everyone understands what these isolation procedures are. We have a few people who are going to be first responders in these isolation events, and they have training as well. But we have made sure that we are training very thoroughly on the signs and symptoms, on the isolation procedures, and that each of these isolation spaces across campus have PPE, including KN95 masks. They also have additional signage to make sure that we're closing those spaces off immediately. Part of what we want to make sure we're doing is following the guidelines from the CDC as best as possible when it comes to cleaning and disinfecting. So there are going to be some spaces, for instance, if there's like the main foyer of the building, if we have a sick person in there, we're not going to be able to close that space off for 24 hours. But if we have a sick person in another space, say it's an office or a classroom, we really want to close that space off for 24 hours and be able to thoroughly sanitize it prior to anyone using it again. And the third piece of that is just making sure we notify the health officials about any close contacts, high-risk contacts, and low-risk contacts. So just to reiterate what a high-risk contact is, it will be anyone who meets that criteria for close contact that we talked about based on the CDC guidance. Those were what the Cobb Douglas DPH, and we're adopting their language. We're adopting their recommendations. Those people would be considered close contacts. They would receive a phone call from the school. We would engage in some contact tracing to make sure that we understand fully what they have, how they've been potentially exposed to a positive COVID case. And then they would receive some recommendations from Cobb Douglas DPH about their need to quarantine for 14 days. If someone is a low risk contact, and Cobb Douglas recently has changed their language and sometimes they're calling it a low exposure contact, then that's someone who's just in the same general area as someone who has tested positive for COVID-19. And in those situations, we will have a letter that just helps families or employees understand again what those signs and symptoms of COVID are, and also helps them understand how they should monitor the health of the low risk contact. But that low risk contact would not need to quarantine. They are welcome to come back to campus. We will continue to do the screenings just like we do with every other student every day, but they are welcome to come back on campus. So let's talk a little bit about facilities, trainings, and staff updates. And some of these things have just been mentioned organically as we've had this conversation. But some of what we've done is we've replaced some furniture on campus. We had quite a few situations where we have introduced tables for collaborative work across campus. It's been one of our key priorities over the last 5 years. So we've had to reboot. We've ordered 166 new desks for the primary school and lower school. There wasn't a single person desk in the entirety of the primary school. They had new furniture delivered yesterday and it looks fantastic. I love the way it looks. It's very cute. I know some of the primary school parents were able to see that today during their orientation. And then we have some additional desks still are being delivered tomorrow. I was talking with the furniture vendor yesterday about, what's a normal delivery for you guys, delivery timeline for you guys now? They're like, there is no such thing. It is impossible to get product. And so we were really very thankful we were able to get all the desks that we needed prior to the start of school. We've also had a very sizable investment in technology for Walker Connect. I think many of you will be engaging in that for the first time on Monday. We did an all-school test of that last week and it went really well. But I know we have worked really hard this summer to make sure that we have not only the technology in place, but that we've also done an enormous amount of professional development so that teachers know how to properly use the technology and have also identified different ways to teach as a result of the need for this technology. We talked earlier about that carpool app. There will be more information about that soon. We really think we'll be able to roll that out within the next 2 weeks or so, and I think it's going to tremendously speed up carpool. It allows us to be able to keep kids in classrooms. Like I said earlier, the more we can keep kids in dens, the happier we're going to be here on this campus. And that's really our goal, to keep those kids in those dens. And so we'll be able to speed up the carpool process. And that same app will be used for the wellness screenings in the morning. We also have invested in, I think, 7 electrostatic handheld and backpack sprayers. And we're using the same cleaning products and bottle sprayers as well all over campus so that we can actually sanitize spaces in a reasonable amount of time every single night. So every single night we'll have a sanitized building. We've invested in new air filters and ventilation improvements. And we've added additional water filling stations across campus. We have more of those to come. And one thing we're very excited about is the addition of a part-time nurse who will be taking on all the contact tracing responsibilities and a lot of the follow-up with parents. Many of you know her. She is a former Walker parent. She has 3 alums who graduated from the school. She has also been a substitute for Dana for quite some time. Her name is Toni Morris. So she's a longtime member of this community and we're thrilled to have her. That will free Dana up to be able to work with our students and our teachers every single day to make sure that we are able to symptom screen, symptom scan in these classrooms and have students move to isolation and then have students move to Walker Connect if need be. We've also completed training for Johns Hopkins contact tracing. I think we probably have at least 6 individuals who've already taken that and probably will have 8 within the next few days. And we have 3 individuals on campus who have completed a pandemic certification on behalf of the school. And as I mentioned earlier, we did teacher training, we did bus driver training, we're engaging in substitute training. Like we had one-on-ones with admin assistants. Every group of people that we can, we're making sure that we have conversations about risk mitigation and to make sure that we're having as many conversations to help with logistics as we start school as possible. One other quick thing, throughout the summer, we also worked with different groups, with the PE department, with fine arts, with some other groups, just make sure, even throughout the summer, we are already starting to dialogue about what safety precautions, what safety enhancements might need to take place during next school year. So let's talk a little bit about the risk mitigation that's happening on the physical campus. And some of this was outlined earlier in the publication we sent out this week, but we just wanted to remind all of you because we do think it's really important the way we've been able to enhance this physical campus. We have one-way routes in the hallways and the stairwells. Those will be particularly useful at the middle school and upper school level during class changes because the hallways can get awfully congested. We've also, those students won't be using lockers, so we'll be able to keep kids flowing a lot more easily. We are not anticipating having a lot of students in the hallways at any one time. And particularly for the lower school, having one-way stairwells, we won't have kids, there will be no bottlenecks in those stairwells. So we're excited about that. We've added plexiglass dividers at all of the reception areas. And we also have some additional plexiglass dividers that we can use in various areas around campus, some that are movable, portable, so we can have them if the situation calls for it. Another big thing that we're excited about that happened this week was we opened the online version of the Wolverine Warehouse. I've been every single day down to the warehouse to see how things are going. So far, I'm hearing rave reviews. I haven't personally bought anything online, but I am excited to do so. I think the online store turned out beautifully, and we're very thankful to the group who worked on putting that together. So what would your students' classroom look like? Well, as we mentioned earlier, no more collaborating around a table, breathing on each other. That doesn't work in this environment. So what we're looking at is student desks being 6 feet apart, facing in the same direction. We're also going to keep visitors out of those classrooms. We're making sure we take attendance and have a seating chart every single day in those classrooms for contact tracing purposes. We have added outdoor classroom spaces, including 7 tents around campus. The 4 largest ones have already been installed. We have 3 smaller ones to come. I said we could be a wedding venue part-time now. We have these big, beautiful white tents all over campus. And we've also removed all that excess furniture from the classroom just to allow kids more space to make sure we can fit them in and still maintain that 6-foot social distancing guideline. Cleaning and sanitizing. So every classroom will have cleaning supplies. We'll be cleaning throughout the day. We'll be particularly cleaning prior to eating snack or eating lunch if we're doing that in the classrooms. Students and employees, if they're sharing objects, will be cleaning those objects before and after use. We'll also be making sure if we're using a shared object that we're cleansing our hands before and after use or using hand sanitizer before and after use. We do use environmentally safe cleaning supplies as much as possible. Our go-to is a product called Genion. It's used often in hospital settings, and it is environmentally friendly. It's approved by the EPA to kill COVID, and it is an ionized water product. We've also, as I mentioned earlier, worked to increase ventilation throughout the space. We're flushing the building with outside air during the night, and during the day, we're increasing our run time so that we have more air flushed throughout the building. We've increased the frequency of our filter changes. We're using higher level MERV air filters, and we've added those air purification systems to those 4 isolation rooms. So dining. And I will say rethinking school in the course of 5 months has been challenging. Nothing more challenging than how you safely feed 1,100 people in about 5-6 buildings over a very short window of time. So most of you have already gotten your forms for next week where you can fill out your forms and request your students' lunch. If you're in primary school or lower school, you have selection of various items that will all be prepackaged. They will be eaten in the classroom or they'll be eaten outside. That's part of what we'll be using the tents for. And then in yellow and green, we have a little more flexibility. We will be able to use the dining hall as we are able to add capacity to some of these classrooms. Throughout the entire process, we are really focusing on keeping spaces limited to people in such a way that we can socially distance. So not only for dining, but for all other activities. It really is a focus of our risk mitigation strategies, that ability to socially distance. But during the orange phase, we're really going to rely a lot on parents in the primary school and lower school to help us by selecting items for their children to eat every day for lunch. And then we're going to individually have them sent to the classrooms so they can eat there or outside, as I said earlier. Middle school and upper school students can fill out their own forms. After this week, they'll be doing an advisory and it'll be really easy. But prior to that, this week, I think they were sent the link earlier in the week. So parent checklist. There was a checklist that came out at the end of July from the CDC and is planning for in-person classes, some things that you can look over. We've actually added it to the coronavirus response page. When we read through it, we thought it had a lot of really good ideas and talks about cloth face coverings. It talks about mental, emotional, social well-being, mental health and social emotional well-being. And it just had a lot of really good points that we have talked a lot about in our committee and within our school environment. And we thought it might be useful for you as well. And I think the last thing I really want to say is something Emily said earlier. And that is that we have spent a lot of time trying to stay caught up on this virus and how to best mitigate for it. And that is not something we intend on letting up on. We have every intention of continuing to stay abreast of all the latest research, latest guidance from the CDC, we've used several children's hospitals, La Bonne Heur, and also the Children's Hospital of Philadelphia have been fantastic resources. We're continuing our relationship with Cobb Douglas DPH, and this is how we're starting school. We are not wed to anything. If there's better guidance that has been peer reviewed and that is good science, we're happy to look at those risk mitigation strategies again. We really are doing this in an effort to keep all of our students, our faculty, and their families safe. And we are approaching it in a way where we're really leading with our heart. We love this school. We love these children. We love our various faculty, staff, and we love your families. And we really, more than anything, want to make sure that we can keep kids on campus every day as much as possible. We are happy to continue to look at, and we actually, frankly, have enjoyed the aspect of learning more about this and how to keep your family safe, and we have no intention of letting up on that. All right, let's do this Q&A, Wolverines.
Sorry, let me unmute. Okay, so I'm gonna go to the question page. We had questions submitted online ahead of time. We had a couple submitted on the Q&A and then some others submitted on the chat. And it's 4:59. We're going to stop at 5:10 because we have an upper school online session that's going to start at 5:15. Any questions that we don't get to, we will answer in an updated frequently asked questions page on our website. And I think, Christy, you said the first question, really the one that's the most prominent question is, how are we going to report and keep our community updated on, cases from an informational standpoint? And do you want me to answer that, or would you like to?
Well, I think I can combine the answer to two questions, because another question was, are you going to continue to look at your metrics to see if you're successful? And I think these are kind of married to one another. We have a set of data points that we plan to look at, and it's going to include, looking at absences, looking at positive cases on campus, looking at the number of students who are tested, or people, not just students, participants in our community who are tested, a whole set of data points that we plan to look at on a very regular basis. And that is how we're going to know if our risk mitigation strategies are effective. But when it comes to communication, our intention is to really stick with the guidance from the Cobb Douglas DPH. We plan to issue those high-risk letters, those low-risk letters, and then if we have community spread, then we plan to let our faculty, staff, and families know.
Yeah, so a question just came in. I just saw, how are we going to enforce mandatory wearing of masks on campus? And I will just say that it's the expectation of everybody on campus that we're going to be wearing masks. We're also continuing to lead with grace, empathy, and understanding. We do not want the mask wearing or social physical distancing or anything to be punitive or shaming in any way. And the nice thing is, if somebody really doesn't want to wear a mask, they have the opportunity to do Walker Connect, you know, from an online perspective. But when we're on campus, in order to keep Wolverines protecting Wolverines, we're going to have the expectation that everybody is going to be wearing masks when they need to. And we also want to provide opportunities for them to get a break from doing that as well. And this will start my 10th year at Walker. Our kids tend to be very willing to do the right thing, particularly when it's explained to them in a way that benefits themselves and helps them help other people along the way. Questions about EDP. EDP in the primary school, since the multi-purpose room has been changed into a classroom, what will EDP look like in the primary school, and what will it look like? And Christy, I think you can probably help with that EDP question.
Yeah, so we really are going to try and do EDPs in dens as much as possible. So in the lower school, we may use some of the larger spaces and have more than one den in a space as long as they can socially distance. But in the primary school, for the most part, we're going to try and use these classrooms in these dens and keep these dens for the entire day together as much as possible. So they will be utilizing the classroom they're in all day.
Okay. Question, will parents be able to walk their children into their classroom on the first day? And I know this is a hard question, and I know, you know, my wife couldn't have imagined not walking our kids into their kindergarten class, first day of kindergarten. But, you know, the answer to that, unfortunately, this year with the pandemic, is going to be no, because we're going to have the students going through those checkpoints to get into class. And in order to keep those mitigation strategies in place, we'll have to let our kids go in, and our parents won't be able to walk in with that. And that's just one of the hard parts of dealing with the pandemic that I wish we didn't have to do, but I think we need to. There's a question about why can't lists of students' den mates be shared? And I will just tell you, part of that is because we're adding students to the grades along the way, and because we're updating those pretty consistently, we don't want to share those until we know that they're pretty nearly finalized. Another question is about understanding that a person that travels would require a 2-week quarantine at home. You know, how will we make sure that people are doing that over holidays like vacation? And you know, the short answer to that is at this time we don't have any requirements that travel requires a quarantine for people in our community. Let's see. If we have a close contact with someone who's COVID positive, is the student expected to stay at home despite being negative? And so that question came up a couple of times. So Christy, you want to address that one?
Yeah, so if the student has had close contact with someone who's COVID positive, then they would need to quarantine. This is based on the regulations or the recommendations of the CDC. So if a student had close contact, they would need to quarantine whether they have the signs and symptoms of COVID or not.
But what if they got a test and the test was negative?
That doesn't matter based on the recommendations of the CDC, because symptoms can develop between 2 and 14 days. So you would still need to make sure you maintain that 14-day quarantine. And that's why the Cobb-Douglas DPH is recommending that you don't get that test until day 10, because that leaves you a couple days to get your test results, and then you're essentially done with your quarantine.
Okay. Reports seem to be changing weekly regarding asymptomatic persons. What is the current thinking on asymptomatic people? Can they spread the virus, not spread the virus? Emily, I think that's probably a good question for you.
Absolutely. So really, when you hear asymptomatic, a lot of the time, what people actually mean is pre-symptomatic. So people who are infected but have not yet begun to show symptoms. We know that people who are COVID positive are contagious 48 hours approximately before they begin showing symptoms. So if someone is transmitting the disease then, they would look like they don't have any symptoms, but they just don't have them yet, which is why those 3 Ws are so important. As to how many people are truly asymptomatic, that they get infected with COVID and they never have any symptoms ever, we just don't have great data on that yet.
Okay, and we'll stick with you, Emily, on this. I see disposable masks are available on an emergency basis, but are they considered appropriate for a student to bring from home on a daily basis?
So I think that that's all right, as long as they fit well. So you want to make sure that that mask is sized appropriately for your child, and you want to make sure that it's got, you know, those layers to really block the flow of air.
Okay,
Of
and
I'm sorry.
will the lower school have shields for children, especially the first graders?
We are using face shields only for activities that are language related, where seeing the mouth or tongue is necessary for instruction. Primary school students are welcome to wear face shields.
I will mention that we allowed students in the primary school summer camp to use the face shields during the summer, and they really did not like them. They strongly preferred the masks, which we were sort of surprised by, but they all strongly preferred the masks. They really seemed to enjoy picking out their mask, having it match what they were wearing, and then they don't seem to be bothered by them at all, was our experience during the summer camp.
Okay, and did we answer the question, can you update Walker families with population level statistics about COVID infections at Walker? Christy,
I think what we said is that it's our intention to share if we have community spread. That is our current intention, is that we're going to make sure people who are high-risk contacts, those close contacts, know and understand that Cobb Douglas DPH is asking them to quarantine, and that we are also following those guidelines. We're going to let families who, if they're a low-risk contact, we'll let them know so they can look for signs and symptoms. And then if there's any community spread, we plan to share that information. And that goes along with a question I just saw in the chat. We will not be quarantining an entire classroom unless every single person in the classroom meets that criteria for close contact, which would mean within 6 feet for 15 minutes or longer, or they shared some sort of item, or they had respiratory droplets on them. It is the recommendation of Cobb Douglas DPH that we would not need to quarantine an entire classroom, just those close contacts, but everyone in that classroom would get that low risk letter, so they would be aware that there was a case in their classroom.
Yeah, and I guess I want to say along those lines, as a dad, although I don't have younger children anymore, if I had children in school, I'd really want to help impress upon them this importance of the 6 feet of physical distancing, because if you can physical distance from everyone, then you're not going to be a high contact. And that's important because that allows you to stay with the consistency of the educational plan you want to follow. I also know, and some of y'all have seen this, and I think we have a comment about it in one of the questions, you know, we're still working on that with our students. They like to gather together, they like to walk together, they like to be together, and that's something we're still working with them on, and we're going to do that, I would say, with gentleness and respect, with grace and empathy, but also we're going to impress upon them how important this is. And the good news is, I think they'll understand it and they'll work with us on there. But it's not part of our natural habit to stay apart 6 feet from each other. So that's just the adults are going to have to continue to work with our students to help them make sure they do that. Okay, I'm looking at 5:10. We had more than 40 questions in the sent in, and then some in the chat room and some online. And I'm sorry we're not able to get to all of them. Emily and Christy, thank you so much for your time. We had 170 something people on today. So grateful for that. Please feel free to send additional questions in. Karen Park and Bailey will be working on updating our frequently asked questions based on the ones that you asked today. And I hope you know that we're going to continue to communicate with you as we've done along the way. So thank you very much. Have a great day. And we look forward to seeing y'all on Monday.
Bye.